We are here to listen to Kelly McCrory talk about working effectively with substance affected families. This is a hugely important topic. We want to make sure we're reaching out to families. I used to work at a child advocacy center as a forensic interviewer, and this is just so important to reach out to and talk to people and get proper training on how to understand, and then just how can we function better as an organization for these families. So I'm going to introduce to you today our lovely speaker, Kelly McCrory. She is from California, and we have had lots of different discussions over that, and we are so excited to have her. She's a native San Diegan. Now she's living in Iowa. So she's the training director at the University of Iowa School of Social Work National Resource Center for Family-Centered Practices. She's the program manager for the Iowa Peer Workforce Collaborative Training Project, and we are so excited to have her and hear from her today. She has all of the things that we need to hear about, all of the experience, all of the knowledge. So we are so excited to hear from you today. So here we go. Kelly, take over.
Thank you, Casey.
Yeah.
Hi, everybody. So glad to see you. I don't know about California, but it's like 7 degrees here. So I envy you. It's probably nice and warm there. These are our learning objectives, what we're going to cover over the next 2 weeks. At the end of the training, you'll be able to describe substance misuse and addiction. What is that circle look like? Differentiate between safety and risk factors for families affected by parental substance use. Define, identify, and promote caregiver protective capacities and protective factors and how they can mitigate identified safety threats. Who else is available to help out? And use safety and risk assessments to inform your safety planning with clear and actionable steps to increase child safety and family unification whenever possible. So a little thing here, we all bring our own personal perspectives to our work, and many including views and experiences regarding addiction and mental illness from our families of origin. A lot of us have grown up in families with addiction or substance use or mental illness. We want to understand that your viewpoint may affect your view of parental substance use. Whatever your personal experiences may come into sometimes into your practice, and that's just human nature. Each person's experience with substance use and mental health disorders is unique, and what worked for you or your family may be different what will work for the families you're working with. So it's not a one size fits all. I come from a long family history of alcoholism. What worked for my family isn't going to work for other people's families. So this is something to think about when you're doing your practice. Discuss any issues with your supervisors to ensure that your own personal experiences or opinions are not interfering with your ability to work objectively with your families. You'll know when you're not feeling comfortable about something. So let's talk a little data. I always like to start with data to kind of set the stage for what are we dealing with? What are we dealing with in the state of California? What are we dealing with nationally when it comes to parental substance use? So this is nationwide. The number of kids in the United States who entered out of home care with either parental alcohol or drug abuse or polydrug abuse as a condition associated with removal. So in FY 2020, which is the most current federal data there is, 33% of kids were removed due to drug abuse by parent and 6% were removed due to alcohol abuse. Does that resonate with how it is in your state? Are you seeing more parents with drug as opposed to alcohol? Are you seeing that same kind of differentiation? If you have, just pop that in chat. So that's 39% of kids being removed due to substance abuse. But when you look at kids 0 to 5 down here, especially 0 to 3, 61.7, so 62 for rounding of kids under 5 are removed due to substance use. Are you seeing that? Is that something you're seeing in the families you're serving, that the younger children are being removed due to this? And feel free to talk. I'd love to have that happen. I'm seeing some yeses here. Great. Is this data surprising to anybody? Or does it seem low, too high? What do we think? Okay. Move the chat over here so I can see it better. So the percent of kids less than 1 year old with a parental drug or alcohol abuse as a condition of associated with removal has jumped enormously. This is 2021 over here, height of the pandemic. We all know that, but it's been an upward trajectory. We're at about 27%, 28 maybe, in 2000 of kids getting removed at less than a year. We've moved up to just shy of 55% of kids. So there's been an enormous jump in the last 20 years of kids being removed due to drug or alcohol abuse as a condition for the removal. Does that surprising anybody? Are you seeing more and more and more kids coming in that are young, very young? And just pop your stuff in your chat. That'd be great. So California data, now keep in mind data is always slow. Things happen, it takes them a while to kind of suss through it, clean it up, and present it to the rest of us. So 2023 was the most recent data I could pull for the state. In 2023 in California, you had 22,000 people that had emergency department visits related to any opioid overdose. So think of your opioid family, over 22,000 people ended up in the ED because of that. Your state had 13.4 million prescriptions for opioids given out statewide. And those are prescriptions. That doesn't count the illegal stuff that's out there. The hardest age group for overdose deaths are people 30 to 39 years old, which are prime parenting years for a lot of people. We look at parenting from like 18 to maybe 50 for people that are having children. And this is 30 to 39-year-olds are the highest number for overdoses. Are you seeing a lot of that too, where you're seeing a lot more people coming in that are in their parenting years that are having lots of issues with drug abuse? And that's what's getting them involved with child welfare. And feel free to talk. I'd love to have some discussion too. So kids in foster care, and this is looking at Q2. This is the most recent data I could pull for July 2024. You had roughly in under two, you had about 2,700 kids in foster care. 1 to 2 year olds, you have about 5,200. 3 to 5, you had 5,500. Total of 41,000 kids in foster care for that quarter in California. As you can see, it gets a little higher here. Lots of things going on there. But let's look at the next slide, which is a little more telling. This is at a point in time, and this is over time. So July 2014 to July 2024, you've had a serious reduction in kids into foster care. You've reduced your number of kids in foster care by 15, almost 16,000 kids since 2014. What are some of the reasons you think that that might be happening? We know that drug abuse is huge right now. What is going on that's causing these numbers to go down? Any ideas or thoughts?
I wanted to chime in. Can you hear me?
Yep, absolutely can. Is this Alejandra?
Yes.
Great.
I think like the narrative of just the social work environment or like CPS is changing their format to more preventive work.
Excellent.
So that's more of the structure why it's reducing. Is it working? That's still in the works, I feel, in
So
many
parents are getting
cases.
in-home services or prevention care sooner.
Yeah, like deferred response, meaning like it's not enough for us to open a case, but enough for us to uh like resource out to like, hey, you might want to do substance abuse. It's not impacting because we can't see the factors for the children,
Hmm.
but there is concern here or open a voluntary case, which means it doesn't go into like the court system.
So people are getting services quicker, it sounds
Yeah.
like. It's being recognized, it's being acknowledged, and people are able to access services before it turns into a child welfare case or a removal case. Is that what I'm hearing?
In a way, yes, it's something that it's developing, I think, for many counties, especially for us, is something more new as we're dedicating social workers into that like field.
The more prevention end of it, things. What county are you in, if you don't mind me asking?
I'm at Calaveras County.
Okay, great. Thank you. Thank you.
I
This
had
is some,
one thought that I wanted to offer.
yeah,
Maybe families are getting more involved quicker
in
to
the
prevent the
system.
child from, no, getting involved with the children and the parents who may be addicted and having babies, that maybe supportive families are getting involved before child services maybe gets involved.
So maybe their own families, that their people around them are getting more involved to kind of preempt this.
Yeah.
That's great news to hear. Great news to hear. I know here in Iowa, preventive services are something that people really focus on. We don't even want to get kids in care. We want to make sure they get what they need before that happens, because we know that's difficult for children. So drug-related deaths in California, this is for a year, August 2023 to July 2024. You had 9,925 drug-related deaths statewide. This is where the numbers get a little fuzzy, but 6,642 indicated any opioid. 6,062 indicated fentanyl. So here, these numbers, you're like, wow, that doesn't equal 9,900. This is the poly drug use. So what they're seeing here is in these deaths, when they do an autopsy, and that's if they're doing an autopsy, they're figuring out what's causing the death. And as we all know fentanyl is huge in this country right now, leading to death a lot. But they're showing that a lot of this is that polydrug use. People are combining a lot of things together, which is causing that overdose death. Have any of you had a parent that's died in one of your cases, or you've worked with a family where someone has died of a drug overdose? You don't need to discuss it, but I just wanted to see if anyone's has had that situation happen. I'm seeing lots of yeses, some nos. Now, this is a tough situation because these folks are younger. They're in that parenting age. So what is it? What are we talking about here today? We all know what addiction is. We've grown up with this. We know what we're talking about, but let's talk about substance use disorder as a diagnosis. According to the Substance Abuse and Mental Health Services Administration, which is also commonly known as SAMHSA, which is an amazing place to get resources. If you're looking for anything around substance use or mental health service, SAMHSA is your go-to. They've got amazing sources. SUDs, and we're going to call them SUDs through the rest of the training, substance use disorders. They occur when the recurrent use of substances is causing clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at work, home, or school. So what are some of the health problems that people can encounter that you're seeing because of their substance use disorder? What kind of things are you seeing? Go ahead and pop that in chat if you want.
What do you mean by that? Like
With
the health,
with
just.
health problems?
Mhm.
Are you seeing people that are getting sick? Are you seeing people that have maybe if they're injecting drugs, are they ending up with HIV? Are they ending up with infections? STIs? Maybe sometimes they're sex workers possibly.
Oh, I think in our county it's a lot of like infections, sepsis, uh,
So
because of the
infections from
yeah.
needles.
Yeah, or just injuries or like they fell and they didn't care for themselves and because the addiction is so severe, they're homeless.
They're
Thus,
not
they're not
accessing the
going.
care.
Yeah.
So things are kind of escalating because of a couple reasons. Probably they don't want to, it's hard to get into care, one. Two, they are afraid of someone recognizing what's going on with them and intervening. Is that what you think is happening in your county?
I think in our county it's a little bit of that and it's also like if you're not our county is very rural, so if you're not having transportation, then there's going to be an issue. Um, or the communication or support system, then there's going to be an issue for you to just go to the front or access because it's miles away
Yes,
from
we have the same issue
wherever.
here in Iowa. We have, lots of counties with no hospital at all. People have to go, 100 miles to get care. So I absolutely understand it. Constantly sick due to impaired immune system, significant impairments, kidney failure, blood clots, infections, STIs, infections. Absolutely. Disability, people unable to work because of their addiction. Maybe it's exacerbating some mental health conditions they might already have. And the failure to meet major responsibilities at work, home, and school. What are some of the things you're seeing that's getting in the way of them meeting their responsibilities to their kids? Go ahead and pop those in chat too. Kids late for school? Absolutely. Or not going to school at all. Anything else there? Unaddressed mental health, toxic stress, marijuana was legalized, so many suppliers are lacing drugs, poor hygiene, kids not enrolled in school at all, access to health and mental resources, older kids taking care of siblings. Yeah, so absolutely. So this is when it starts to become a disorder, when it's causing the significant impairment with those health issues, the disability, the failure to meet major responsibilities. Maybe they're not going to work on a regular basis, or they're not working anymore. Maybe they've been fired because of their substance use. Maybe their home is not being taken care of, things like that. Unable to consistently provide food, safe shelter, body care, diapers. Exactly. So what's the criteria for a substance disorder when you're looking at the DSM-TR 5-TR? That's the most recent one. It's moving to the 6. I'm not sure if I think it's close. They keep teasing us with that, but that craving that I need to use. It's not something that you can just ignore. It is an absolute craving. Wanting to cut down or stop, but not able to. Like today, I'm going to stop doing this. Today, I'm not going to drink. Today, I'm not going to do this. And you just can't do it. Taking the substance in larger amounts or for longer than you meant to. Maybe you say, I'm going to go out with friends, I'm going to have 2 beers, and the next thing you know, it's tomorrow and you've had a lot more than 2 beers. or you say, I'm just going to have a little bit of this, and it turns into something else. Neglecting other parts of your life because of that substance use. It gets in the way of, like you're talking about here, inability to meet basic needs, changing the diaper on time, things like that. Continuing to use even when it causes problems in relationships. How many of you are working with families where there's a clash with partners because of substance use? And using substances even when it puts you in danger. And for women, this can be putting themselves in very precarious positions. For men, it can be putting them in precarious positions too. So these things are the criteria for diagnosing a substance use disorder. I know you don't diagnose. I don't think most of you diagnose, but this is really what this leads to. So let's talk about the families you're currently working with. We've got 4 categories here. Impaired control. I'm not able to control myself. I'm not able to control my behavior. The idea of physical dependence. I need to have this. This is what guides my day. I need to do this. Social problems. Maybe there's been a problem with family. Maybe there's been a problem with jobs. Maybe friends are going away, or maybe friends are not healthy friends. And then this idea of risky youth. Can you give me an example of something you might have seen? And you can be free to talk out loud. I'd love to have that with impaired control. If you run across this with any of the clients we're serving, where they are really impaired when it comes to how they're controlling their life. I'll go to full screen here so I can see everybody. Anybody have any examples of what that looks like to you?
I've had clients where they can't control their emotions, like lashing out in anger or being really like heavy mood swings, and it's like really out of their control.
Mm-hmm. They don't want to be this angry. They don't want to have this, but it's like you said, it's out of their control. Absolutely. Impaired control of your emotions. Excuse me. Anything else? Seeing lack of finances, reckless spending, like unable to control the dollars. I know I need to save this money to buy this for my child, but I really need this instead, like i.e. I need some drugs. Falling asleep when they need to be awake. I really shouldn't be taking a nap right now. I've got toddlers running around.
Some people think it's the norm and that's all they're used to and that's all they know.
Mm-hmm.
That's just a part of their behavior. They grew up in a household that's all they did.
Yep. Yep.
Continuing the legacy of, which is a sad legacy, but it's a legacy of within that family.
Yeah, this is how I learned how to parent. Is that what you're saying, Black Diamond? Like I learned how to, this is what I saw, so this is how I parent,
Yes.
because I really don't know any different. Do
Yeah.
most of us parent how we were parented? Absolutely. What about physical dependence? What are you seeing around that?
Like domestic violence or relationships that are toxic with family members, dysfunctional relationships with children, older children.
Like teenagers? Mm-hmm. What about social problems? What are you seeing with that when a parent's substance use involved?
Okay, so I've seen isolation. A lot of the
Yes.
bridges have been burned or,
What people don't know, they don't know. So I'm going to hide. Yep. Or absolutely bridges that burned.
uh-huh. Or
Yeah.
families know the history depending on the cycles, and then they become totally isolated and don't know how to
Good.
break that.
Now we've got mistrust, like people don't trust you or you don't trust people. Inability to connect with people anymore. Constant contact with law enforcement, not normally the social group you want to hang out with, normally. Anything else there? They don't want to have anything to share with, they don't have anything to share with others, so they might stay away. What about risky use? What are you seeing around risky use? Oh, nobody wants to be around you anymore. What about risky use?
Just hanging out with the wrong crowd, just using from other people because you're at like the last resource, so you're just using, not knowing what you're using many a time, and many times cause additional addiction or overdoses. Oh,
So you're a little less careful with the friend group because what what you need is what you need and they've got it and you're really not sure what
yeah.
you're getting. Is that what the risk is there, Alejandra?
Yes. And
Okay.
also the risk of using is just doing things that are out of your norm. You would be like fully there. So like stealing or getting into homes that are
Yep. I'm seeing willing to steal from family, more open to having unsafe sex, using in front of kids. What someone might say, I would never have done that, and now I am. Stealing from families, using in front of kids, taking kids with you when you're on a run, things like that. That's all risky use. Excellent, excellent. Thank you. So how does this all happen? Well, how does it happen that people come to have addiction? Gotta move some of these so I can see my own slides. Sorry. No one factor can predict this. A lot of people say, oh, it's genetics. You know, if everybody in my family did this, it's inevitable. This is going to happen to me. But no one factor can predict if a person will become dependent on substances. It's a combination of factors that influence that risk for addiction. The more risk factors someone has, the greater the chance that taking drugs can lead to addiction. That's not saying the more risk factors, it's a done deal. It's just saying the risk is higher. So the things that are biology, the genes that people are born with account for about half of a person's risk for addiction. Gender, ethnicity, the presence of other mental health disorders maybe can also influence risk for drug abuse and addiction, depending on, you know, what's going on in your life, your biology. The environment you surround yourself with. A person's environment includes many different influences from family and friends to our economic status, general quality of life. I think Black Diamond brought that up. If there's generational trauma in the family or generational use in the family, factors such as peer pressure, you know, a lot of kids start with peer pressure, plain and simple. You know,
I also see it with exposure because little Drew Barrymore was exposed to it at a very early age.
yeah, like 13 or
And,
11,
and
wasn't
she was
it?
drinking, and everybody around her didn't mind, and they were adults. They did not mind her drinking and getting drunk and high. And then you have these celebrity children who they have the access to their money. And as long as they're paying their parents whatever amount or giving them a part of their money, they're not caring. So they're
Only when the
completely
child
out
becomes the
of
adult.
control. Yeah, there's some that I won't name, but there's some children that you can see that that's where they're headed now just because of the behavior. And they're in the news all the time. They're on TikTok and they're doing so many different things. And the parents have to know. And the things that they're saying, the clothes that they're wearing, how they're trying to emulate people and things, and people think it's cute. You
But
know,
the parents are also getting a money stream out of this too, aren't
yeah,
they?
yeah, but then I'm not gonna actually say I'll fault them, but we sit there and we watch it and their ratings go up. We
They get
watch
more
the
likes and
behaviors.
clicks and
Yeah,
stuff. Hmm.
yeah. So we're watching, oh, let me see what this one is doing next week or tomorrow. And then it goes up and up and up and they like it more and more and more. And it's just they're just out of control.
Yeah, we have this thing in the United States that we like to build people up, and then when they crash, we kind of celebrate it. Like, oh, I knew that was going to happen. You know, things like that. We kind of have you seen that with celebrities sometimes, especially people who have had addiction issues that, oh, we knew this was going to happen. And
Yeah, you
they
can
kind of
look
they
at
fall.
you can look at the ones that may not have been exposed to it, or I won't say exposed because I'm quite sure many of them have, but you can look at some of the celebrities who are going on now who have expired because of drugs.
Hmm.
You know, some people say, well, they have so much money. Why would they want to go to that? What stress could they possibly have? Being on stage is stressful. Trying to meet your commitments can be stressful. They're just
Life is
like we
stressful.
are.
Yeah,
Yeah, it is.
absolutely.
And they have to give
Absolutely.
more than what we're giving. We just get up and go to work and we have to deal with the people here at work with, within the departments. But they're dealing with people across the nation
Hmm.
and they have to perform and they have to be right.
And people are waiting for them to fall, right?
Yeah. Oh
Yeah,
yeah. If you
absolutely.
fall,
Yeah,
there's somebody
so the
waiting to take your
environment is
place.
a big factor on what affects some of this. You know, that peer pressure, physical and sexual abuse, early, like you said already, early exposure to drugs, stress. How many of you are not stressed right now? How many of you are like, yay, 2025, can't wait? I saw a lot of self-care, a lot of wellness in your chat on what your thing is like, because I'm kind of stressed. I need to chill a little bit. Parental guidance can greatly affect a person's likelihood of drug use or addiction. And then development. These two together, biology, environment, and our development, genetic and environmental factors interact with those critical development stages in a person's life that can really affect addiction risk. Although taking drugs at any age can lead to addiction, there is data that the earlier the drug use starts, the more likely it will progress to addiction. I'm sure some of you already have kids in care that are already using drugs at this point that may be in addiction. Areas in the brains that control decision-making, judgment, self-control are still developing. Kids are high-risk people. They like risk. They take risks. So that can be another thing with the environment. If the risky environment, their biology, the developmental stage can lead to that too. So let's look at the cycle. The cycle here is pretty basic. Initial use. You don't become a drug addict or an alcoholic or a substance use person disorder unless you've tried something in the first place. Okay, so initial use. And for a lot of people, that's not for me. For other people, it turns into abuse. Abuse is using it in a way that's harmful. When I do this, that happens. When I do this, that happens. When I drink too much alcohol, I do things I regret. When I smoke dope, I do something I regret. The thing we need to remember here is that the substance can cause a rush of dopamine to be released. And that's what people are chasing, this high that reinforces the use. I'm always looking, someone put that in earlier, chasing that first high. A lot of people are trying to chase that first high. So abuse is doing something in a way that's harmful. Tolerance is an indication that the brain has changed in response to the drug use. For methamphetamine or other stimulant drugs, it could include a loss of certain brain chemical receptors or a decrease in some of our brain chemical production. The person's brain adjusts over time to what they're doing, and it changes how it responds to the presence of that drug in their brain. And this over time will lead to the next stage, which is dependence. I'm building up this tolerance, and that can happen with alcohol, it can happen with drugs. The more I build that tolerance, the more I start to become dependent. Now my body is needing this. My brain needs this. It's dependent on that substance to be able to function how we think is properly. As an example, a person who's been using cocaine or meth for a really long time may find it impossible to feel pleasure without the drug. That's anhedonia. It's when you're unable to experience joy or pleasure. That part of your brain is just kind of gone. You feel numb or less interested in things you once enjoyed because of this dependence, because of this damage that's been happening in your brain. And then we get to addiction. So there's 5 stages here. When we get to addiction, it's a specific chronic mental health disorder that results in defined symptoms and behaviors that can be used to diagnose the condition. Think back to when we talked about the DSM. All those things being met, we're into addiction. And there's 11 signs that we can look for that can talk to us about signs and symptoms of SUDs. And I'm sure a lot of these are going to be very familiar to a lot of you. Taking the substance in larger amounts or for longer than you meant to. We talked about that a little earlier. I'm going to go to a party. I'm going to leave at midnight. I'm going to do this. I'm not going to do that. And the next thing you know, it's long past that. You did exactly what you said you weren't going to do. Finding it difficult to control substance use or stop substance use, even when it causes harm. And this is probably what's happening with some of your families is they know that it's causing problems for them. It's causing problems for them in their parenting, but they just can't change that. They can't stop it. Experiencing relationship or family problems or having use get in the way of other parts of your life. If maybe I'm using to the point where I really can't make it to my job. I'm using to the point where I'm not getting up in time to take care of my baby. I'm not getting my kids to school on time. I'm not making sure they're having proper nutrition. Spending large amounts of time seeking drugs, using substances, or recovering from use. Your day becomes about use. I'm either looking for it, I'm using it, or I'm coming down. You stop participating in favorite activities in favor of substance use, and that goes back to that isolation. I really can't go do that anymore because I'm so involved in my addiction. I really can't spend time doing things I used to want to do. Unable to keep up with daily responsibilities due to substance use. Maybe you've got someone who's like, I used to keep my house clean. My kids always had clean clothes on, and I just can't do that anymore. I don't have the ability. Cravings. How many of you are coffee drinkers? Just raise your hand for me. I see a lot of coffee drinkers. Okay. If you don't have coffee, by the time you normally have coffee, what do you feel like? Like
Higher.
no big deal? Oh, so I'm sorry, Marlon, go ahead.
Higher.
You feel tired, even though you just probably woke up? Yeah, and if you drink the cup of coffee, what happens?
I'm ready to rock it.
So this is a very small example of that idea of craving. For those of us that are coffee drinkers, I actually get up at 4 in the morning. I'm a real early bird, and I have about 3 cups of double espresso before I go to work. One weekend, I thought, I'm sleeping in. I slept until 9 and woke up with the most enormous migraine. I could barely function. I was just, and it didn't dawn on me that I had not had 6 shots of espresso yet. So I had a big old cup of coffee. I started to feel a little better. And that's the craving, is that I need that. And with drugs, it's 1,000 times worse, 1,000 times more. That I need this to function. I need this to feel right. I need this to get right. Continue to use despite negative health effects. We've talked about those health effects. Even though these bad things are happening, or I keep having this happen, or I've got this infection, or whatever, I keep doing it. And those can be physical or psychological health effects. I'm with somebody that constantly is abusing me, they're speaking poorly to me, but there's something about this person that keeps me able to use, so I put up with it. Regularly using the substance in dangerous situations. That can be where you go, where you use, who you use with, what you do to be able to use or procure your drugs. Regularly, more of the drug is needed to produce the same feeling, that idea of tolerance, when maybe a year ago you were using this and now you're using a lot more. How many of you have seen some of your clients progress a little bit? Maybe their drug use now is a lot worse than it was 6 months ago. Yep, I'm seeing lots of headaches here. I love coffee, can't function. Maria, I hear you. I hear you. So cranky, absolutely. Fatigue, irritable. Yeah, those are all withdrawal symptoms. And then experiencing those withdrawal symptoms when use has stopped. This is what keeps people using, is the unbearable pain of the withdrawal. So what's the potential impact on the individual themselves? Physical and mental health issues, increased spread of infectious disease, trauma. How does trauma stem from this? How would that happen? Let me know what you think about that. How is that an impact on an individual based on substance use?
Your body is going through a change that it hasn't adapted to and hasn't been exposed to before.
So your
So
body's being traumatized?
yeah, your
Okay.
body, and it's just working its way throughout the body. And just like you had mentioned with the coffee, I'm not a coffee drinker, but look what's happening when you don't even get it. When you don't get your coffee, look what happens when they don't get.
Okay, so physical trauma, that this is something I absolutely have to have. What else?
I think the mental trauma is more when you're coming down from the drug and you realize the actions that you've done, then you be like want to get high at a sooner time, from my understanding when I speak to clients, because you recognize that what you did is not acceptable and you're fully there person.
Absolutely. You're like, whoa, what did I just do? Excuse me. I don't want to think about that. I don't want to think about what just happened. So I need to blot it out. Very good. Absolutely. What about loss of productivity? Losing a job. How many of you have had clients who have lost jobs over their substance use? How's that handled? Anybody want to speak to that? We also have the family issues, which is child welfare involvement. You know, this is a potential impact on the family, is that substance abuse is leading to other people coming into your life to take care of your children for you. It sounds like you guys are doing a really great work in the state with prevention, but we still have family issues where kids end up under child welfare protection. Homelessness, Social isolation, we've talked about that quite a bit, where you don't want to be around others. And these might be people who have always been very social, but they don't want others knowing what they're doing. They might be ashamed, embarrassed. They're not proud of who they are when they're using. There's lots of reasons that go into that social isolation. And then increased exposure to crime and violence. Now, why? Why is there an increased exposure to crime and violence? Why would someone have that happen because of their drug use? We got over here.
Because they're looking for it. They're looking for drugs and they ended up in places that they're not supposed to be there.
Yeah, they might be going places they normally wouldn't go if they weren't looking for drugs. Yeah, absolutely.
I believe it's because they start hanging out with a crowd that is in the same use of drug, and when you don't have it causes for you to find a way by just becoming a criminal. It's
Okay,
just
and someone
becoming
put
a
that in
criminal
having to
mind.
steal to get the money for drugs,
And
theft of
that's
money,
another
theft of
addiction.
drugs. Yep. The company you keep is not a company you normally would want to keep, maybe. Need money, desperation, and going to places and talking to people trying to get the drugs. People put themselves in a lot of risk to
There
do
are
this.
times when I'll say some young ladies who are groomed, where they're runaways or they find themselves lost in some way, to where they meet Mr. or Mrs. Wrong and
Mm-hmm.
provide them with the drugs, and they continue to provide them, but then they wind up owing them. So
Mm-hmm.
in order for them
Sex
to pay
trafficking.
them back, exactly, they have
Yep.
to do whatever it is necessary. But the bottom line is they'll never pay them back. They're going to always owe them in some shape, form, or fashion. And they're going to increase the amount of drugs, and they're going to introduce them to other drugs and cause them to recruit people as well. So it's just going to continue to go on and on and on for them.
How many of you have worked with clients who are like, I wish you knew me when I was sober? Or or this isn't really me. Have you had people say to you, this isn't really me? I'm not, this is not me. Alicia, you've had that happen. Can you talk about that a little bit?
Or I can speak of myself. I always say my past is the define of who I am now. But yes,
Yeah.
I do have clients that say, like, for example, I had a client that was a nurse and said, that's not me. It's just the group that I fell into, or I was on a prescription and it caused for me to need a higher prescription and a higher prescription, and I fell into this addiction.
Mm-hmm. And if she was a nurse, I'm assuming
She was a nurse.
she might have started stealing.
She did.
Yep. Stealing
Yeah.
drugs, might have lost, maybe got her license suspended. Yep, absolutely. The knowing before sober led to not being sober. Shindana, can you explain that to me a little bit? I think I get it, but would you mind explaining that? And I hope I pronounced your name correctly.
Oh, my name's Shindana. Thank you.
Shindana, sorry.
No worries. I think the things that happen are the things that kind of contributed to them being maybe in that state before being or using or what have you. Maybe those things are the things that led to
Like the egg came before the chicken.
Yeah, right.
Okay,
That
got
was part
that.
of their journey.
Absolutely.
Mhm.
Maybe they were sober and hanging around with a crowd that was getting involved in drugs, and they kind of just went along for the ride, maybe.
Or even maybe they were doing so good at masking all the problems that they were having that they thought they were doing a great job at, the beauty, the softness, the kindness, or whatever else that they
Mm-hmm.
maybe are holding shame to, that all they're seeing is that mask that they were holding for other folks.
So okay, excellent point. Thank you for bringing that up. Absolutely. People using drugs and alcohol to numb discomforts. People use that all the time in social situations. How many people have you known that say, I need a drink before I go to something, or I need to do this before I go in front of all those people. I'm anxious. If I have a couple drinks, I feel better. I can make social, things like that.
Yeah, when people's getting on the airplane, they need to take a drink because they can't handle the flight.
Yeah, there's a lot of people with a lot of alcohol on airplanes lately, I'll tell you.
I've had a friend, her mother was very verbally abusive to her, and every time she was around her mom, she had to like drink or, pop a pill or something just to deal with her because she
Kind of
couldn't
just to
take the
brace herself a
abuse.
little bit.
Yeah.
Wow. I'm sorry. How's she doing now?
She's sober now. She's in treatment. She's been in treatment for 3 years, on and off, but she's been absolutely sober for about now.
Good for her. But yeah, it's probably the trauma of her childhood was probably being thrown up
Mhm.
in her face a lot. Is that kind of, or is that what she was still like kind of having like flashbacks almost, or just because the mom's abuse just continued? Is that what I'm?
Just continued. Her mom was just very verbally abusive. She was not supportive. Every time she would try to get clean, she'd be like, "Oh, you're just gonna relapse again. That's just who you are."
Wow.
So she was constantly just like putting her down just all the time. Just so she didn't really have support. She didn't have
Yeah.
that support that she needed to get clean.
Especially the
Um,
person she probably needed the support from too.
yeah, that she needed the
Yeah.
most. So I was kind of just there for just to encourage her, like, you need to do this for yourself, not for anybody else. You do it for you.
Yeah. And sometimes when people have never had anybody do anything, they've never been able to do anything for themselves. They've been given that message all their life. You're not good enough, you're not this, you're not that, or you've tried to get sober before, you never, there's a lot of messages people can get that just pile up on top of each other. And it sounds like Shandana said almost like in order to maintain the relationship with her mom, she probably felt she had to maintain the use just to be able to be in the room with her. Yeah, I can see
Yeah.
that. Absolutely. So these are the impacts on people. And I'm sure you've got clients you're working with, if they've been substance involved, even if they haven't been substance involved, that have had a lot of these things happen to them. Some people have lots of this happening to them all at once. So is this a voluntary behavior? How many times have you heard, well, just quit? Why don't they just quit? Just put it down. Stop buying. Stop going to the store. Stop doing this. Stop doing that. The initial decision is voluntary. I'm sure most of us have had that decision in our life about, are we going to do this or not? Sometimes that happens in junior high, high school, middle school. Sometimes it happens to people as they become young adults, but there is that initial decision. But no one makes that decision thinking, I'm going to become a drug addict. That's not the decision they're making. But repeated drug use can lead to, again, those brain changes that challenge a person's sense of self-control and interfere with their ability to resist those urges. So that going back to that cycle where we go into initial use, abuse, tolerance, all those kind of things. But these brain changes can be persistent, which is why drug addiction is considered a relapsing disease. It has the same rate of survival, for lack of a better term, or of cure as most chronic diseases do. It's kind of got the same level of cure. But people in recovery from drug use disorders are at increased risk for returning to drug use even after years of not taking the drug. I'm sure you've all worked with some people who maybe have been sober for a really long time and something happened and they weren't. So these long-term use can also cause changes in other brain chemicals and circuits as well, affecting functions that include their learning. How are they able to learn? Are they able to get a job where they might have to learn how to do something? Are they able to maintain that knowledge? Judgment. How many of you have clients that their judgment is a little tough? They're not using the best judgment. Decision making. Making decisions is something that they just have a hard time with. Stress, memory, behavior. So these are things that when we have long-term use, and how many of you have clients, and you can put this in chat, where you're seeing some of this because of their long-term use, they're struggling with some of this. They're struggling with judgment. They're struggling with decision making. Someone said paranoid. What else?
I just
Memory,
wanted to
behavior.
chime in
Yeah.
that one of the things that I've noticed a lot is when a person is recovering, a lot of times there is mental medication that's provided because they're coming down and
Mm-hmm.
there's a connection there, but they're also like a lot of time they're misdiagnosed because a lot of the symptoms is from them recovering and becoming sober and they're misdiagnosed with like schizophrenia
Yes,
or
yes, that
bipolar
happens a
disorder.
lot because they're not looking at when the person's coming down or impacted by drugs, it can mimic so much other stuff that it's really important that there's a mental health assessment. They're doing it at the right possible time. So Catherine said, absolutely no memory or decision making. It's impacted. Paranoid, excellent. So even people being aware of these harmful outcomes, people can still use drugs, continue to take them, which is the nature of addiction. They can see, it's that strong. It's absolutely that strong that it can really overtake your what we consider to be common sense. Like, well, if you know this, why don't you do it? Because it's a physical addiction. I've seen people who have tried to stop one addiction and the process forms another. Yep. Relapsing disease, with the choice being the maintaining, sustaining, changing, but the disease part makes the choice to change that much more difficult. Yes, very true. So these are just some things I've heard over my time. Why are drugs hard to quit? You don't have a problem. Parenting is hard. Give yourself a break and have a drink. Those kids should just be adopted. They will never get sober. Parents are never going to get sober. They should just go to get the kids adopted. If you really loved your kids, you would stop. You should go to AA. That's the only way to get sober. So let's look and see what the National Institute on Drug Abuse, which is called NIDA, has to say about that. There we go. Some people said they've had some masking, especially with holidays and added stress with family. Holidays are a very stressful time for families, aren't they? How many of you have had clients that this is a rough time of the year for them? Maybe they haven't had good relations with families. Maybe they're not, they haven't been with families. They're a little uncomfortable. Definitely, of course, to the extent they've lost custody of their kids. Yep. It is a rough time of the year. It's a rough time of the year, weather-wise, everything else too. So let's talk about post-acute withdrawal symptoms. When you've got someone that is going into recovery, withdrawals, especially for the drugs we're seeing now, like our opioids, things like that, are really, really rough. Very difficult for people. Their brains are screaming at them. So PAWS, or post-acute withdrawal syndrome, refers to a more lasting effects of withdrawal that may make it very hard to stay sober. Using the substances for a long time or using a heavy amount will lead to more severe PAWS symptoms. Alcohol withdrawal may take 6 months to a year. And this isn't saying you're going to be in that miserable withdrawal for 6 months to a year, but it can take a long time for your body to recuperate, to your body to get back to where it was before. Opioids can take up to 2 years. But that peak withdrawal may occur within that 48 to 72 hours, and symptoms may clear within 1 to 3 weeks. Have any of you experienced clients that have gone through opioid withdrawal while you've been working with them? What was that like for them?
It was awful. I mean, it was awful to see them like that, definitely. Just the throwing up, and I mean, they relapsed 2 or 3 times and finally, they stuck it out, and but they got through it.
Yeah.
There was a light at the end of the tunnel.
And I've heard it's like the worst flu times 20.
Oh yeah, like they couldn't stay still, like they're fidgeting.
Mm-hmm.
Their legs were like restless. They were sweating. They're like had circles under the like they weren't sleeping at all. And
Were they in a rehab facility? Were they doing this on their own?
they were trying to do it on their own, and then I recommended that they get into a rehab facility to possibly have a doctor monitor, because there are medications that they can give them to kind of help ease it a little bit.
Mm-hmm.
And monitored by a doctor and all of that. So they did end up doing that, and they went into a rehab facility, and they got through it, and they made it, and they got through the withdrawals.
That's amazing. That's great to hear.
So it is possible.
Yeah. And alcohol is one of the few things that the withdrawal can be fatal. Most drugs, you're not going to have a client die from that, but sometimes with alcohol, if they're seizing or they're not being monitored, there can be a real problem if they've got heavy alcohol use. It's not a sign of failure. It just means they're in recovery. And recovery is there's a couple schools of thought on recovery. Some people talk about being in recovery as a lifetime journey. Other people are like, I've recovered, I'm done, I'm moving on. So we need to respect that everyone has their different ways of talking about what their recovery is. So the pause symptoms show up as the brain is starting to reset from that drug and alcohol use. Because think of your brain literally on fire and screaming at you and making your whole body hurt. Like, I'm going to torture you until you give me what I need. And you're not giving it to me. So I'm going to really make you suffer. That's what I think about when I think about withdrawal. It is your brain basically telling you, you are going to suffer for this. Someone in my circle gets teary-eyed stating out loud that their addiction is being triggered, and at the very moment they would be using, but instead they out loud tend to that part of them and use different coping skills. Such a beautiful insight. So they're really it sounds like they're really vocal about it, that I'm working on this. Is that what I'm reading in that, Shindana? Am I reading that right? That, yep, 3 years clean. Good for them. Yay. I love to hear that. So yeah, these symptoms are because your brain is on a reset. Your brain's going, okay, we're not getting what we need. We need to figure out how to cope with that. And that's going to take some time. Severe alcohol abuse can cause dementia-like symptoms. Absolutely. Absolutely. So some of the symptoms people might have when they're in this withdrawal, inability to think clearly, short-term memory lapses, emotional outbursts, irritability, anger, mood swings. They're in pain, physical pain, mental pain, sleep problems. Someone had mentioned that. Insomnia, disturbed sleep. They're not getting good, solid sleep. They might not be able to sleep. You'd think that, oh gosh, if I could just sleep, I'd feel better. Low energy, dizziness, coordination issues, sluggish reflexes, balance problems, overreaction to stress with panic attacks, headaches, physical aches, and pains. So if you're seeing this with some of your clients, you might wonder if they're going into withdrawal. So overdose deaths. Before we start talking about recovery, let's talk about this because this has been an issue in our country since the opioid pandemic started in the late, in the 2000s, 2010s. You guys have been hit very hard by this, just like every other state has been hit by hard. I think the coasts have had it worse. Methamphetamine is still the drug in Iowa, but our overdose rates in our primary parenting years have exploded. So we have here 2021, 2022, and this was during the pandemic, so there's probably some effect of that in here. But when you look at your 47.3 deaths per 100,000 up to 52.9 the following year, 53.9 to 62 between that 35 and 44, basically 50 to 53 in our 45 to 54-year-olds. This is really interesting. This jump in our 55 plus, 37 to 45, and then 65 and older. So these are people per 100,000. How many people have had in the United States with drug overdoses? But this is who you're working with, people in their primary parenting years, and they have had the highest rates of overdose deaths across time. Yeah, you're right. It does follow. I've never even noticed that, Brendan. It does follow a bell curve. And why do you think that these years have higher rates? What's going on there, do you think? What's going on with those parenting years? What's happening with folks that you think that this is our higher, because this is showing up in the data over and over and over again, that these age ranges tend to have the highest overdose rates. What's going on there, do you think?
I wanted to chime in. I believe that sometimes at that age group, the stress of work and, trying to succeed and, seeing all the different stressors in your life can cause for you to try to numb in order to make it,
Yeah.
So they start thinking, well, let me numb myself. Let me do this and try this and see if this will help me, So that can cause that at that age group.
Yeah, look at the marketing we've seen towards moms and wine, moms and drinking. There's been a lot of that. Wine o'clock, things like that. How many of you are you seeing some of that? Are you still seeing some of that marketing in California? Or there's a lot on Insta or TikTok or things like that where people are talking about it's time for some wine. Midlife crisis. Yeah, toxic stress. This is probably for most people, and I'm speaking as myself, probably some of the most stressful years of my life was when I was parenting and holding down a full-time job and going to school. This is a hard time for people. It's still surprising over here. We're seeing these large numbers. I don't know if that's COVID related. It'll be interesting when the government catches up with data, how this plays out over time. I'm curious. Children growing up and leaving the house and parents lonely. That could talk about that empty nest syndrome. I don't have to worry about my kids now, so maybe I can drink a little more, or I can party like I used to, or whatever. Teens, college years. There's a mindfulness yoga class. Okay, Anna, talk to us about that. What is that?
I have a friend that teaches that class here in Sonoma County. It's a
Well,
yoga
you're in
class for
Sonoma. That
moms.
makes a difference.
Yeah, it's a yoga class for moms in which they drink wine.
While they do yoga.
Right.
Wow. That's kind of impressive that they can hold a class and do yoga, but what do you think about that?
Um, I I myself I don't drink alcohol, so
Yeah.
I wouldn't attend that class.
Yeah. I've never heard of that. It's pretty interesting. Um, Sydney says, I almost wonder if there's also a correlation between moving out of high school and college years, typically using more party drugs than using more opiates outside of the party scene. Yeah, I think about also people, young teenagers, sports injuries, wisdom teeth, things where they're getting Vicodin, Percocet, things like that that are opioids. Absolutely. Wine and art classes are very popular too. Yeah, 55 to 64 has to do with the boom in drug use in the 50s and 60s, aging body, lots of reasons, lots of reasons. So let's talk about recovery. I love to talk about recovery because we have really opened our eyes in this country to what recovery can be. For the longest time, there was really one way to recovery. What was that one way to recovery for a long time? Anybody know? Abstinence, yep. Abstinence, absolutely. What else? AA, cold turkey, methadone, yep. Methadone's making a comeback. AA was kind of the gold standard for a long time and stopping cold turkey. I'm gonna quit, they quit. And as we talked about earlier with withdrawal, that can be really painful and ugly for people. So let's talk about recovery. There's 4 major dimensions to support a life in recovery. And we've talked about these on how they, some of this has affected people negatively. Now we're going to talk about how it's going to affect them positively. So SAMHSA, that's Substance Abuse Mental Health Service Agency that I talked about earlier, they have decided that there's 4 major dimensions that support a life in recovery. And this is through their Recovery Support Strategic Initiative. This is something that's come out in the last couple of years. One is home, one is health, one is purpose, and one is community. So let's kind of dive into that a little bit. Home, a safe and stable place to live. How hard is that for some of your clients to have that safe and stable place to live?
I believe that when some of our clients that are, trying to make a change in their life, it becomes difficult when they don't have that home anymore and they're craving, to be sober. So they try their best to get, once they're in a stable home or they get, through recovery and are in a stable home, it makes them, it kind of clicks to make that change and
I've
find,
got this now.
I got
I can
this
get
now,
this
I can do
place.
this. Yeah.
It just sounds good, doesn't it? Safe and stable. That just sounds warm and cozy. I want to go home to a place that's safe and stable. Absolutely. But it's hard. It's hard. You guys have very expensive housing in California. It's sometimes this is hard to get for people, isn't it? Part 2 is the health, overcoming or managing one's diseases or symptoms, abstaining from the use of alcohol, illicit drugs, non-prescribed medications if one has an addiction problem, and for everyone in recovery, making informed, healthy choices that support physical and emotional well-being. This can be a tough switch for people, especially if there's been some health damage. Maybe they've had some issues with their health while they were using, and now they're kind of having to get those things fixed. Maybe they've got undiagnosed diabetes or things going on where they're having to get that managed. So the ability to get access to make those informed, healthy choices. What is a healthy choice? And where can I get that physical and emotional support for my well-being? Because when we talk about health, we're not just talking about physical health. We're talking about emotional health also. Layers of needs, yes. And some of these folks might have needs that are so buried and have been around for so long that this can take a lot of time, a lot of effort to really dig through and find out what's going on. Purpose. This is my favorite one. We all need a purpose, relationships and social networks that provide support, friendship, love, and hope. We talked earlier about sometimes people are not surrounded by support, friendship, love, or hope, are they? They're surrounded by things that don't support any of that. So the idea of the support, relationships, social networks, is that hard for people when they're coming out at, when you've got parents where you have substance use? Is this really hard for them to find sometimes, this purpose? The chronic pain question, absolutely. What do you do? The chronic pain doesn't go away because you got clean, does it? But how hard is this for some of your families to find this purpose?
I think it's really hard sometimes because they've never been modeled, you know, what healthy support is, or what healthy friendship is, or boundaries. So a lot of them
Boundaries.
really do lack hope. And I think that really has, you know, ties in with their purpose in life, or for themselves too. I know me and my team were having a conversation about this yesterday of, you know, social connections really matter. So if a family doesn't have that, you know, sometimes that can really impact them.
Mm-hmm. I think this is something we kind of are struggling with as a country sometimes. I think after the pandemic, a lot of us got very isolated. Dysfunction. Sherry's saying dysfunctional families, addicted friends, difficult to look outside yourself. Shauna, relationships hard to sustain when they're unreliable. Absolutely. And if you're getting sober and your partner's not, that can really struggle with the relationship also.
I can just add one thought, Kelly, and to the team
Absolutely.
is like, you know, I'm just sitting here thinking and listening to everything that's being shared. And it's like, you know, people have, you know, substance issues, okay, and then they want to stop, but then they have all this reality that they have to try to come to terms with. And that could be, at very least, I would think, overwhelming, and like,
Oh,
what
yeah.
do we do with all of these layers of just things? I don't know. Wow. It's a lot.
I think that's where the community, which is what we're going to talk about next, can help. Because, you know, you don't get sober one day and go, okay, now I need a house, I need a health, I need a purpose, and I need my community. Those things don't come like that. Most of us who have lived our lives sober, or lived our lives, you know, with a healthy relationship with alcohol, have kind of built these things over time, right? And sometimes people might have this and it gets destroyed in the process, or maybe they didn't have it to start with. So you make an excellent point, Gina. So let's talk about that community. Relationships and social networks that provide support, friendship, love, and hope, which is what we wanted to see with our purpose, such as a job, school, volunteerism, family caretaking, or creative endeavors, and the independence, income, and resources to participate in society. To me, this is a critical piece here, that sometimes the community might need to come first to feel fully engaged in the community you live in. And Linda makes a good point. It's very I think this is very difficult because these people are constantly judged and criticized. But Linda, I got a question for you on that way. How do we help them turn that around? What helps with that? How do we help people move past the constantly judged and criticized? Anybody can kick in on that, whatever you guys have
I
thoughts
think
there.
it's important that you find, like, I know that it's like what we usually push them, but in A groups or A groups, because they've gone through the same process and they're in different steps of it.
Mm-hmm.
And it gives them assurance that they're capable of doing in this positive feedback, because not just going into A means you're just expressing yourself, but also finding a community that
Yes.
can you're able to vent in a more honest approach, and also they can provide you with more guidance and support in establishing a support.
Sometimes that's where people start that community, is in treatment or in wellness centers or wherever they're getting help. That's sometimes where they start, because there's not going to be a lot of that guilt and shame with people who have walked the same path you have, right? They're not going to be constantly poking at you on that. And maybe by building that smaller community first helps you step out in that larger community. But do we all agree that this kind of stuff is pretty critical to well-being? That we need to have home, we need to have health, we need to have purpose, and we need to have community. And as that is part of the, I wouldn't call it a recipe for recovery, but something to base recovery around, can really, you know, get people feeling that they're back part of society, especially when they feel like they've been ostracized or not part of society. Maslow's hierarchy of needs. Absolutely. Absolutely. So recovery paths. We all know there's more than one way to recovery, right? And everyone's individual and everyone's got their own way of doing it. So we're going to talk a little bit about that. People choose their recovery pathway based on several things. What are their cultural values? What is their socioeconomic status? What can they afford? The psychological and behavioral needs they might have. Maybe getting sober is uncovering some things that might be going on with them with their mental health. And the nature of their substance use disorder. What are they addicted to? How long have they been addicted? What's the withdrawal like? So on. This is a very personalized and varied stake of what's going on. So it's really impossible to categorize every single type of recovery. It's really going to be what resonates with somebody else. That's why the AA is a wonderful, wonderful way to go, but it doesn't work for everybody. Other people, that doesn't work for some people. So there's natural recovery. Natural recovery is people going cold turkey, like many of you had mentioned earlier. Just stopping. I come from a family of cold turkey people. They hit their limit, things happened, they were not going to do it anymore, and they didn't. That doesn't work for everybody. It could be because we're very stubborn people, I don't know, but that's what's worked for my brother, my father, my grandfather, generations going back of my side of the family. Recovery mutual aid groups, those are our AAs, our Cocaine Anonymous, our NAs, things like that. Some people really thrive in that environment. They need that environment, and that's a very embracing environment. Then there's also medication-assisted recovery or medication-assisted treatment, MAT, the methadone, buprenorphine, naltrexone, where people who, especially with opioid disorders, this can really help them. They can really go into this, and this helps them get their life back. It helps them be able to be a part of society. Peer-based recovery supports. Part of my job is running peer training for the state of Iowa. And I see amazing stuff happening in recovery communities where peers are helping peers. Recovery coaches, peer support specialists that have been there, done that, walked the walk, and understand where the person's coming from. They've got that shared lived experience. Family recovery, the whole family comes into recovery. Maybe if that's a child that's in recovery and the family comes around, maybe a couple where one partner is coming into recovery, the other one's not had it, they come together and they do some family recovery. Technology-based recovery, a lot of people, they use their phone or their laptop to connect with recovery communities. And then alternative recovery supports. There is a lot of different ways to do this, and that's why we call it multiple pathways to recovery. You take the one that works for you, and it might be, you get down that path and you're like, yeah, now I need to go over to this path. But I think sometimes people get that very narrow mind that I have to do this or I have to do that, and I'm not doing either one. So when they know there's other abilities out there, yay. So 12 steps, we all know about 12 steps. Dual recovery anonymous, people with a dual diagnosis, they've got a mental health issue going on and a substance use issue. Most people with dual diagnosis, that's a large percentage of people, about 60%. You've got your non-religious, smart recovery, life ring. A lot of people bring their faith into this. Spiritual religious, there's White Bison, Recovery Dharma, Refuge Recovery, Celebrate Recovery. A lot of churches do that. Alcoholics for Christ. I mean, people, any way you want to come in, there's a way to find it. The MAT, the treatment directory that SAMHSA has will help you find those clinics that provide MAT. And that's that medication-assisted treatment. Wellness-based recovery, yoga practice, meditation, Tai Chi. There's lots of, we have a lot of wellness support centers here in our state. I don't know about your state, but it's a great place to kind of surround yourself with like-minded people who are trying to get sober. Active sober communities, the Phoenix, Fit to Recover, where people can get online, talk to each other, go places. Online recovery supports, it's called In the Rooms. Some people, especially if you're in a highly rural community, maybe it's hard to get someplace, or maybe there isn't a lot available, but you can get all that, do that online kind of find some support online. Lots of this, it's changing all the time. I tried to find things that have been around a while, but this is something where you can really tap into your own community and say, hey, what do you recommend? What's going on out there? Harm reduction. You guys, I gotta hand it to you. We are not, in Iowa, fentanyl test strips are considered drug paraphernalia. You can get arrested for having fentanyl test strips in the state of Iowa. You guys have them and are able to use them. The California Harm Reduction Initiative, CHRI, was awarded $61 million for harm reduction and overdose prevention in July 2023. Have you heard about that? Yeah, it's a lot of money to really work on harm reduction and overdose prevention. So, oh, Lynn, sorry to hear that. But her son lives in LA near the fires. So what is it? Harm reduction is lots of things. Fentanyl test strips, where people can test their drugs to make sure there's not fentanyl in it. Because we know that fentanyl is pretty much in everything nowadays. Naloxone delivery, where they get naloxone so they can use that. Naloxone is like Narcan, helps people with overdoses. I know a lot of people here carry that. Some states, the libraries have them. Law enforcement has them. There's lots of places that have that. But naloxone, drug treatment provision and navigation, helping people navigate the system, helping people find that. And that's something that you can all help with by tapping into some of that. And then the overdose response training, teaching people in the community how to respond to an overdose. There's a lot more with this, but this is a really amazing thing that I hope you all can kind of tap into and see what's available for you for when you're working with clients, what's available in your community. This is a lot, $61 million. I used to think that was a lot of money, but now we're getting into billions, so maybe not, but still, this is a forward thinking on the part of your state to start doing our, do you have needle exchanges in California? I couldn't find anything around that. Is that legal there? Any ideas? Haley put some more resources in here too. Thank you, Haley, for that. Okay, so we've talked about what goes on and how people, how drugs affect people. And all of you that work in the field, you know this. So let's talk about how we're going to plan for safety. And we're going to end our day, when we're done today, we're going to end with a case study that we're all going to do together, because next week when we come back, we're going to do breakout rooms. And I've got 4 case studies for our next one where we're going to talk about what would you do. And I've asked CalTrin to mix you guys up so you're not in the same group every time, because you all come from across a very large state with lots of different resources. So I really want the ability for you to find out what other people are doing in other parts of your state, and we kind of get away from that idea of groupthink. So every time we do a case study next Wednesday, you'll be in a new group each time. So let's talk about planning for safety, and then we'll go into our case study for today. So a parent's substance use can affect their ability to safely parent their children by decreasing their ability to do the following: adequately supervise their kids, right? It's very hard to keep an eye on a toddler if you're passed out on the couch. Meeting their child's educational or medical needs. You guys had talked about that earlier with kids not getting to school late, not good hygiene. Medical needs. How many of you are working with families where the children are medically fragile, where they need things done on a regular basis? Providing a daily structure and routine for a child. We know those are healthy for kids. Kids like a routine. And then provide for the child's basic needs. Now, what are basic needs for a child? What are some of those basic needs that we expect someone to provide for a child?
So housing, food, education needs, transportation, medical needs,
Safety.
Safety.
and
Mhm. There's lots of stuff we have to do as parents, right? Any of you that are parents probably know there's a lot of stuff we have to do to provide for their basic needs, which can be hard to do when the money's going somewhere else. So child safety decisions. Key questions. How is substance abuse or dependence affecting the parent's ability to make sound judgments regarding the welfare of the child? Excuse me, sorry. How is that affecting that ability? Are they able to make solid, sound judgments regarding their children? What behaviors are resulting or have resulted from the parent's abuse or dependence on substances that's creating present or impending danger? What's going on that is either going to be dangerous or is dangerous right now? Because risk and safety are different, right? Is there evidence that the home itself is unsafe? So these are things we want to think about. How's their abuse impacting their ability to make these decisions? Are they able to make clear decisions? Are they able to understand the ramifications? What are the behaviors that are resulting from their dependence that's creating this dangerous possible situation? And is there evidence that the house itself isn't safe? And what are some things that could be in a house that could make it unsafe? What are some of the things you've seen when you've gone to homes that can make a home unsafe for a child?
Well,
You can
just
put that in, go ahead, sorry.
I was gonna say just the basic, maybe the drugs, in the access of the children who are being passed out and maybe like a blunt or something.
Yep.
Um, Still active and they can cause harm with play dangerous or having coworkers or friends that are using.
I'm seeing in the chat, I'm seeing mold and cockroaches, hoarding, broken windows, lack of cleanliness, children having access to the drugs that may be available, especially with fentanyl. Anything that's that toxic. Household may not be clean, may not have food, lack of love or communication, lots of people in and out of the house, strangers coming in, improper security, supervision of folks who enter and come in, unsafe housing, wires, stairs, maybe stairs are broken, maybe there's no railing on stairs, maybe you've got a toddler who shouldn't be on stairs at all without someone holding their hand. Heat and cold. Heat in Iowa is tragic. It's 7 degrees outside right now. If you don't have heat in your house, you're not living long. No running water. Yep, absolutely. Great list, everybody. Good job. So safety refers to present or impending danger from maltreatment. Lack of safety signals a need for immediate action. If this child is not safe, we have to do something. Risk refers to the probability or likelihood that a child will suffer maltreatment in the future. There's a risk going on in there that leads you to believe we need to address something here because there's a probability or likelihood that something's going to happen. Safety means it's impending. If we don't fix this, it's going to happen. The identification of risks help determine the focus of the change process and issues that will impact successful intervention. So what do we need to do? We need to identify this stuff to figure out, okay, if it's risky, what needs to happen to make this not risky? If it's not safe, are there things we can do to make it safe? Or is it so unsafe the child needs to come out of the home? So considerations for assessing child safety, the age of the child. An infant is much more vulnerable than a 16-year-old. Now, I'm not saying 16-year-olds aren't vulnerable, but if they get rolled over in their sleep, they're probably going to roll over and get out of the way. So infants, toddlers, the age of the child. Is the child visible in the community? And what do you think that means by visible in the community? Why is that a consideration in assessing child safety, that visibility in the community? Attending school or daycare? Absolutely. Someone else knows they're around. School age, if the neighbors see them, are they allowed out of the home? Absolutely. Yeah, does someone know they're around? Have you ever gone to homes where neighbors didn't know they had kids? Maybe they weren't registered in school, they never were in the yard, things like that. Different eyes on the child's well-being, absolutely. Special needs of the child. Does the child have an intellectual disability, a physical disability? Does the child need a special diet? Are there things going on that, if they're not attended to, are going to cause risk or harm or death to the child? Just a child dressed appropriate for the weather. I got to tell you, here in Iowa, middle school boys think the best thing to wear in the middle of 7-degree weather are slicky shorts, like basketball shorts. It's like a test of manhood here. I couldn't believe it when my son, I'm like, what are you doing? But it's like this phenomena here. So luckily they didn't take him away. Although when he was 13, they could have taken him for a hot minute. That would have been a little okay. But yeah, you got to think about that. Now, a 4-year-old in shorts outside, not good. A 14-year-old, you're like, yeah, let's talk about that. Got to have a little levity in here somewhere. And that parent-child interaction. How are the parents and the child working together? Are you hearing the child being disregarded? Are you hearing the child being spoken to harshly? Is the child being acknowledged at all? Is the child being called by its name? How are they interacting together? Does the child seem afraid of the parent? Does the child cringe? Does the child not want to be held by the parent? What's going on there? So these are things that you're taking into account when you're looking at that, when you're assessing. Child seeking resources, parents are responsible. Yeah, the child may be going to the neighbor and saying, hey, do you have some food? Possible advocacy for the children's safety and welfare, appropriate for weather. So other things to think about here. Current engagement in treatment. Is this parent currently attending to treatment? Are they doing what, they're in treatment, they're trying to get better? What's going on there? Or are they kind of like, I don't think I need the help? Is there a history of seeking help or treatment? Have they reached out in the past, or has there been other engagement with the boy wears shorts in the snow? It is self-correcting. Thank you, John. History of seeking help or treatment. Yep. Past recovery time. Had they been clean in the past? And this is a relapse. Have they had some significant clean time behind them that this is maybe a lapse? The level of parent insight into the risk factors. So if like talk about my son wearing the shorts, if they came in and said, do you understand why it's not a good idea when it's 0 that your kid wears shorts to school? And I went, well, what's wrong with it? It's his decision. If he wants to freeze to death, that's his problem. Not good assessment of my child's safety. So level of parent insight into risk factors. Are the parents aware? And some of this could be because they're young and this is their first child and they really don't know. It could be that they need some education about risk factors, or it could be they just don't, that's not something on their radar. Do they have a strong support system? Are there other people? Is there kin, fictive kin, other people that can come in and help? Is there another adult living in the home? Who is that other adult living in the home? Are they related? Are they not related? Why is that other adult living in the home? Is there, and what are the strengths of the family? And we've talked about this at the very beginning, that strengths of the family, you need to look at more than just the people. You need to look at everything about who they are. Because what I think are strengths for a family that are culturally appropriate for my family might not be the same for somebody else. So we really need to think about what is the strengths of this family. How do we know their strengths? Potential indicators to support your assessment of the home environment, the condition of the home. What's going on there? Is it dirty? Do you have electrical outlets that are broken? Do you have open wires? Do you have drugs in reach of children? Do you have broken appliances? Do you have broken plates on your lights, broken windows? Is there a crib if a baby needs a crib? If there is one, is it in good shape? Safe storage of controlled substances that people are using, are they keeping that away from the kids? Cleaning fluids, if they've got cleaning fluids or medicines or other things, are they in places where children can't get to them? Is there drug paraphernalia in the home? Are we seeing papers, pipes, needles laying around where kids can get at them? Because even if they've shot what they're going to shoot, there's still something on that needle. Safe sleep space. Does the child have a place to sleep? Is it safe? Are they surrounded by things that are going to harm them? Pets in the home. Are the pets aggressive? Are the pets not aggressive? Safety hazards, tripping hazards, things that can get in the way of a child being safe in that home. So prenatal substance use exposure, we're going to have a case study on this. How many of you have had that happen where you've got a child who's been had prenatal substance use? You can just pop it in the chat if you want. Yes, okay. Quite a few of you, yeah. Wow. Okay, thank you. Prenatal substance exposure may be demonstrated by the following. Positive toxicology screen from mother or child at delivery. Infant showing signs of substance withdrawal. A fetal alcohol spectrum disorder, FASD diagnosis, or other credible information that there was prenatal substance abuse by the mother. Maybe they admit it. Maybe someone has witnessed drug use while pregnant. Maybe they come in withdrawal, things like that. So that's something else that's a safety issue. A lot of you have experienced this. But a positive toxicology screen at time of delivery is not in of itself a sufficient basis for a mandated report. But if after the assessment, there are other factors presenting risk to the child, a report should be made to by the healthcare provider to CPS. So positive toxicology screen is not by itself enough for a mandated report, but there needs to be an assessment. So let's go back to that assessment piece. Are we seeing infants in withdrawal? Are we seeing other information that there's something else going on here that maybe the OBGYN who's taking care of the mom said, she's been using while she's been we've been noticing that, we've been working on this, or maybe they hadn't had any prenatal care at all, or there's an FASD diagnosis.
There's sometimes where the mother may have a positive toxicology, but she could be on a prescribed medication from the doctor. And if that's the case, and they can verify it, then that's not a basis to, well, they still have to make the call because they can then offer the family preservation, so they can teach and talk to the mother about preserving the family and how to keep her medication safe and away from the children. But they also have to look at the ability of the parent, if the parent's capable of caring for an infant, whether they're under the influence written by a doctor's prescription, or whether it's a street drug that they borrowed from somebody or purchased.
It's a excuse me, it can kind of be a gray area sometimes, because you've got to be able to get the information, which can be hard to do. And there's also people who are on MAT, medication assisted treatment, that they've used that throughout their pregnancy in an amount that's not going to harm the child. So there's a lot of things going on here. So that's why that assessment piece is critical. What's going on here? What's happening? Is this something legal that the mom is on for something else? Is this something illegal that she just did? Who knows? There's a lot that needs to go into that. Nothing is really a slam dunk in child welfare, which I think is sometimes hard because there's so many areas of gray. So safety planning, written documents detailing in-home protective interventions. What's going on in the house to protect the child? What do we got? What are we doing? Allow the children to stay in home if the protective interventions mitigate the identified safety threats. So if this is the problem, what we're doing as protective interventions, if that mitigates that safety threat, takes care of that safety threat, they can probably stay in home. So let's say the house needs heat. Your concern is this is a freezing cold house. You find out that we can get this person signed up with that maybe we can get the back bill paid, or get that heat turned on, or talk to the landlord, or what's going on here, and we can mitigate some of those threats. The plans developed during the initial assessment and continued through ongoing services. So this is not a one and done. While we got to do a lot of work here, we're constantly monitoring it. Are things getting better over time? Routinely monitored and updated based on families' changing circumstances and needs. Families change all the time. Families' needs changes, circumstances change. They might have a job, maybe they lose a job. Maybe they've gone through treatment, they've been sober for a long time, and they have a short-lived relapse. So these are things that is not a one and done plan. Well, I did my plan, 2 years ago. This is the plan. We know all of us have changed in the last 2 years. That plan needs to be looked at all the time. What's going on? Okay, so now we're going to go into our case example. I'm going to go to the next slide so you'll know what we're talking about. But for this one, we're going to talk about if it's a safety issue, why? Why would it be a safety issue? If it's a risk issue, why? And what else might we want to know before deciding on in-home or out-of-home placement? Are we going to is this a situation where the child can stay with a parent, or do we need to look for an out-of-home placement? So as a group, this is the one we're going to do together, and you guys can chat with each other. I'm not going to be guiding you through this. I'm going to listen to you all talk, but let's go back and do the story. And I'll read that to you. So our case example is Mary. A nurse at the hospital contacted child welfare to report a newborn and his mother both tested positive for opioids, and the baby was beginning to show signs of neonatal abstinence syndrome, which is really a neonatal abstinence syndrome is withdrawal for infants. Loud, high-pitched crying, excessively fussy, shaking. The hospital social worker observed the child and interviewed the mother and called CPS. The mother tells CPS she does not consider herself dependent on opioids, but acknowledged that she knew its impact on her behavior. She states she brought the pills with her to the hospital and has taken several since John's birth. That's the son. She does not have a prescription for them. She says the reason she has not been able to keep her son with her or take care of him is because she is dizzy and somewhat disoriented due to the pills. So the reason the nurse called is because the mother really had no interest in the baby. She didn't want to nurse. She didn't want to take him. She didn't want to hold him. She really wasn't engaging with him. So, and he was very fussy. So, and she said that the reason she has not been able to keep her son in room care with her or take care of him is because of this dizziness and disorientation due to these opioids that she's taking. So that's the case. Any questions about this? that I might be able to answer before we move on? Okay. Is it a safety issue?
Yeah, I do have a question. Yeah,
Absolutely.
you mentioned it was a newborn. Was the baby under 30 days old? Where it was
The baby was
actually
just born. The baby was having neonatal abstinence withdrawal.
okay.
Yeah, she just delivered the baby in the hospital.
Okay.
And she's, like when you have a baby in the hospital, they kind of want you to sometimes hold a baby or learn how to change the diaper. And she wasn't interested in that. She wasn't feeling like she could do it because of what she's doing. So I'm seeing safety issues. I'm seeing high risk. I could see it as both. Let's talk about it. What are we thinking? Is it, if you think it's a safety issue, why? I'm going to go to full screen here so I can see everybody and the chat. I see someone saying out of home, safety and high risk, both. Child's health and well-being was already negatively impacted. High risk should be out of home. So are we thinking this is safety? Are we thinking this baby should not go home with mom? I wish we had a raise your hand. Use that little virtual hand if you think this is a safety issue. There's a thing called raise hand at the bottom. Okay. I'm seeing some hands up, but not a lot. Can it be both? Not normally. We got to pick one or the other because we do different things depending on what it is. Okay, I'm seeing a lot of votes. Yes, I'm seeing a lot not voting at all. So I don't know if that means no. So if you believe this is a safety issue, talk to me. Why do we think this is a safety issue? The button is at the bottom where it says raise hand. You'll see a little hand next to that green share. And you just click on that and then it has a little hand you can use.
So it's a safety issue from my concern, in the aspect that the mom is impaired and that she's taking substance to the point that she took him to the hospital in order to continue using.
Okay.
Also that the child has been pre-exposed to those substances as he's having withdrawals.
Okay. So Alejandro's saying, she brought the drugs with her to the hospital. She obviously had been taking them because the child's in withdrawal. Okay, so she thinks that's a safety issue. Anybody else on a safety issue that wants to talk about that?
I would like to just simply add, mom is not able to even hold the baby and start the bonding process. She's got her pills that she brought to the hospital and she's shaky. So that's I think a red flag there as well.
Yeah, she doesn't seem to feel safe with the baby, does she?
Nope. That's what
She's
I would say.
afraid. Okay.
I wanted to piggyback off of Gina. Yeah, I believe that she's in withdrawal and she's also in her addiction at the same time. So I believe that that would be a safety issue for the child going home with mom, knowing that she went ahead and brought medication to the hospital to keep using, and then seeing the baby, withdrawing from it can be a red flag.
Okay. Okay. Anybody think it's a risk issue? No criticism here. We're just talking this through because this is the best way to think through child welfare is by having many voices. Any thoughts on risk?
Yes.
Okay, let's hear it.
The risk is that if we do allow mom to take the child home, first we haven't identified if she has established a home or has a home, or she has prepared herself for caring for her child. So
Okay.
those are one of the main risk factors, as we don't know what her prenatal care was or
Okay.
for the math for the child to be home.
So some stuff we need to know here, isn't there? I'm going to go back over risk and safety for someone.
I think one of the things is once the mother had the baby and the department gets notification, we should also find out if this is the mother's first baby And if this is something that has happened before, because that could be
Okay.
a whole can of worms for mom.
Yeah.
And
Is this the
they
third
can
child that
be-
this has happened or?
Right.
Yeah.
Then we have to see mom's mental health status because although she may be using substances, and I'm not saying it's an excuse, but we also have to look at mom's mental health status as well.
Does she understand what the ramifications are here? So safety refers to present or impending danger from maltreatment. Lack of safety signals a need for immediate action. So if the child is not safe because of impending danger from maltreatment, that's a safety issue. Immediate action, we have to do something right away. Risk refers to the probability or likelihood that a child will suffer maltreatment in the future. So this identification helps determine what we're gonna do here.
Kelly, if I can add also, that maybe in this immediate situation, I think it's a lot of safety issues, but then what is the risk when the mom and the baby is going to be released from the hospital? And I think a couple people here have already shared. Is
Yes.
there a father involved that's maybe knows about this baby? Is there a support system that mom may have? So that can, so I think it's a constant process of evolving and evaluating, excuse me.
Yeah, I'm hearing that there's lots of things we need to know here.
Yeah.
We can't make a decision right away, right? And then we probably need to make a decision pretty quickly, right? But what do we need to know? What else might you want to know before deciding on in-home or out-of-home placement?
So
So what are
you
you
have to
thinking?
assess the safety of the newborn, which includes assessing the parent or the caregiver's interaction with the newborn to determine their responsiveness to the newborn and the newborn's needs. Because if she is unable to do that, that right there is a red flag before you even think about sending them home. So that's a safety and a risk
Okay.
at the same time.
Other thoughts?
I think also including like the father of the child. What if the father is not in using or active or aware of the substance use as they're not together? There's a lot of factors because he can make the decision of caring for the child and making like arrangements for the child to be cared by another family member if he's not able or
Yeah,
capable.
does he even know? You're a good point. Does he even know what's going on here? So we need to know who else is around, right? Family-wise and other. What else do we want to know? I heard something else. Can we make a decision today without knowing more about this situation?
No.
I think we can start reaching out and see if mom or talk to mom and see if she has any supportive family. I mean, the father is definitely, I think high on the priority to
Yeah, we want to
evaluate
find
him.
him.
He
And
made
maybe
his
he just wasn't in the room when this happened. Who knows?
right. We don't know.
Getting a cup of coffee.
Absolutely, because sometimes you have moms that are using and they have fathers that are clean, but they may not know that she was pregnant or whatever the multiple situation that could have happened. I think the other thing I would look at is, does mom have other family members in addition to the father? What about mom having other supports, and could they be possible, supports for this mom and her newborn?
Yeah, I mean, mom might need to go into treatment, especially if it's an opioid addiction. She might need to go into treatment, but we've got family or father that can take care of this baby. And then, so we
We also
can't.
have to do the same. We have to address the same thing with the father. We're saying that he can take care of him, but we have to worry about the level of functioning for him as well. And whether he can recognize that there is a problem. And sometimes fathers may not be able to take that type of screaming that this baby may have. So then we may be looking at or facing shaken baby syndrome when that baby won't stop crying. So we
Oh,
have to go
excellent
through
point.
various
Excellent
things.
point. Because this baby's going to go through withdrawal for a couple of days. The baby's fussy. And it might be the father, maybe if they're married in the same house, didn't really realize what was going on because she was hiding it.
And we might have to do a lap too, because it could be domestic violence in the home as well. So I would fully investigate both before
Well,
I
I'm
make
really
it.
glad you guys didn't just jump to a conclusion. I think you've got an idea in your mind what might need to happen, but it sounds like you're like, we need to know more before we make this decision. It sounds like a safety issue. Absolutely. Right now, she's protected because she's in the hospital and someone's keeping an eye on what's going on with the child, right? But they don't let you stay in the hospital forever when you have a baby, do they? They want you to go home at some point and do it on your own. So this is something we would need to figure out pretty fast, wouldn't we? We'd need to get supports in place. Absolutely. So there's a lot of things we need to find out. We need to hunt down some people. I'm hearing that definitely. We might want to know where she's, why, what, had she had opioids for something else and that moved into an addiction. and that's why she's getting them illegally. You know, what's going on there? When did this all start? You know, maybe she was having opioids for something else. You know, who knows? There's just so many things we need to know. Is there anything else that you guys can think of that we have not thought about before we go to our Q&A?
I was
Yeah,
saying go ahead, and then I'll go.
No, you can go, Gina. Fine.
Okay, thanks, Alejandro. Yeah, the other thing is I want to, I don't know if somebody already said it, but what is mom's awareness of her, having those pills? Does she feel like she needs help? You know, what's the evaluation around that? How does she get to this space? Does she feel like she needs help? Because her awareness of, does she need treatment? Does she not? I mean, because that's going to speak a lot to her willingness if she does need help or she doesn't, and to be able to kind of be the mother to this child that maybe she wants to
Yeah,
be.
I mean, she was pretty open with the nurse. I'm afraid to do this because I've been taking these pills and I feel disoriented and dizzy. So she's admitted that, you
Right.
know, she's
But
not
But
trying.
but to what extent is that a problem for her and this big,
Exactly. And we don't know that, do we?
but we need to,
So we probably need a drug assessment, don't we? Or a substance abuse assessment. Yeah.
Well,
Good.
we don't even
Anything
know.
else?
We
Yeah,
don't
the
even know if mom
baby.
even wants the baby. She may have been pregnant and had the baby and whatnot. So that could be a sign of her not wanting to be very close to the baby and, you know, just not being compliant with us. She may not even want the baby, or unfortunately, she could be carrying a baby for somebody else. You know, some people do that.
So we have a lot of questions to ask this
So much
person,
going
right?
on.
And her people around her. We have a lot of questions to ask before we can actually, but we have a timeline too, right? We can't spread this out over a month. They're not,
Yeah.
that baby's going to go home someday quickly. You know, I don't know in California, but most people only get a couple days in the hospital. So we probably have to get this figured out pretty fast. So we got some tasks to take care of, don't we?
Yeah. And I think
Okay.
we've focused on the mom a lot, but we haven't focused on getting like all the exams for the child to see, like test the umbilical cord to see how long the mom had been using while pregnant with the child, and
Yeah.
if it's other substances, because we haven't evaluated the whole situation, but we also have to it determines the time frame for us as well if the kid has to stay longer. So we have
Yeah, it
more
might
time
be
to
until we can
investigate.
get all this figured out that maybe a child needs to come in care for a week or two because it's going to take us that long to get the information.
But
Who know?
also
Who
just like
knows?
just the withdrawal symptoms, sometimes they keep them for up to, I know for fentanyl, it's like up to a month and a half, sometimes two.
An
So
infant?
yeah, to manage his withdrawal.
Yeah,
So it just
I'm glad they
varies.
do that.
It depends on how they're responding to the medication that they're providing to the baby. Baby may be doing well today, but tomorrow it could be another story.
Yeah, my baby might have trouble latching on to feed. There's lots of things that can go on. Well, this is exactly what we're going to be doing next week. So I want to move over to our Q&A time. I'm going to leave, you see that slide on there. I'm going to put the stop share on for this. Actually, so we're going to do some questions and answers. And then just, next week we'll come back and we'll start talking about that safety plan.